So what age-related macular degeneration tests do you require? One of the easiest tests is just testing your eyesight at home to make sure that you can read well, that lines look straight when you're reading the paper, and it's important to test this with one eye at a time. If you notice that letters are jumping or that there may be a patch where letters are disappearing into, it's important to seek help quickly. Now, your optometrist can examine your eye and give you a broad understanding of what's happening in the community. Ultimately, a retina specialist will have the full remit of tests that are available. Now, when patients come to see me, I would test their eyesight as usual. I would dilate their eyes, I would examine their eyes. And I would also perform what's called an OCT, or optical coherence tomography scan. This is a scan that uses specialized lasers to create a map of the retina in microscopic detail. It is highly sensitive at picking up any fluid and detecting wet macular degeneration if it's present. One of the charts I give my patients to monitor at home is an AMSA chart, and this is available to download from the Sight Clinic website. The AMSA chart is a very simple test to use. You test it with one eye at a time using your reading glasses. It's a grid of very fine squares with a black dot in the middle, and it's just used to check if the lines are straight, if they're becoming distorted, in other words they're becoming wavy and wobbly, or there's a patch that's prominently absent on the chart, then it's an indication that you need an urgent scan of your retina. It's a very sensitive test, but it does need to be tested on a regular basis. I would recommend at least weekly, and it's important to do it one eye at a time. If you don't do it one eye at a time, your brain is very clever at ignoring the abnormal picture, and unfortunately I have seen patients who have lost significant vision in one eye without knowing there was a problem until it was too late. With early detection, it is possible to prevent visual loss in macular degeneration. If the OCT scan that I perform does not show any abnormalities, under certain circumstances I will proceed to evaluate you with what's called a fluorescein angiogram. An angiogram is a study of the blood vessels of the eye, and I don't give an injection into the eye, I give an injection of a yellow dye into your hand. This then flows around your body, and we take lots and lots of photographs of your eye, which helps me identify different pathology. Your skin can be a little yellow afterwards, and your urine will come out very yellow, which can frighten patients. This is harmless, it's just the dye leaving your body.